Mr. Daniele? Ms. Cayley? Mr. Lightfoot is excused. Dr. Quattro? Mr. Rocco? Chairwoman Draw.
Here. Is there anyone signed up for public forum?
There is not this evening.
Then the next item on the agenda is the approval of minutes. You have before you the May 24, 2011 minutes. They will stand approved unless the clerk is notified of any changes by the end of the day. The next item on the agenda is new business. Madam Clerk.
Referral 11-170.
Moved by Legislator Rocco, second by Legislator Quattro. Is there any discussion on that? Seeing none, all those in favor signify by saying aye. And the opposed, item carries. Next item.
Referral 11-182.
Moved by Legislator Quattro, second by Legislator Daniele. Any discussion? Legislator Andrews.
Thank you, Madam Chair. Through you to the administration, I do have a few questions about this, our involvement in the Rio here. I've heard of this, I think so. We're on 182, correct?
182, yes,
Yep.
correct.
I know I've just heard of this that's starting, this exchange, this health exchange that's starting in our community. And I guess just as sort of a beginning question, could somebody explain what Rio really is and what our participation in it will bring or will entail? Thank you.
Through you, Madam Chair, about 5 or 10 years ago, the federal government announced that the strategy for connecting up all of the medical care providers in the country was to establish something called regional health information organizations. And that started a process whereby many regions around the country, some states are a single region, a state like New York is multiple medical marketplaces. Each region has set out to develop a health information exchange. What that really means is a means by which healthcare organizations can share information. And Rochester set up a health information organization with grant dollars from the state, and it has been operating for about 5 years. It has very strong support from all the healthcare organizations in our community, the hospitals, the health insurance plans, and the RBA. As a matter of fact, Sandy Parker, the CEO of the RBA, is the chair of the Rio board. I'm on the Rio board as well. The idea is that if you have a electronic medical record in your office, you can accept information from a lab or a radiology practice or some other provider of health information. It can be sent to you electronically, and it can be downloaded into your electronic medical record. It helps reduce the amount of paper. It helps with elimination of errors. Another tool that the medical care providers have found very helpful is the practice of using electronic prescribing instead of having little paper prescriptions that are written by doctors that have very poor handwriting. There is now a system that's widely used in the community in which physicians can type onto a computer screen a prescription and then electronically send it to a pharmacy. That information is then kept in the physician's electronic medical record, but is also then in a database in the pharmacy. There's another application that's widely used for physicians that don't yet have electronic health records, and that is that they can view electronic health information, but they don't have to actually download it electronically into their electronic health record. So if they order a blood test on a patient in the morning, they can look at the viewer in the afternoon and they can see all of the blood tests or all of the chest x-rays or all of the various types of diagnostic tests that they've ordered that day, rather than calling the lab or calling the radiology practice, and they can get all of the results from all of the tests that they've ordered that day. The system is quite advanced in Monroe County. We have one of the most advanced RIOs around the country. The next big frontier is connecting all the RIOs in New York State, so we'll have a single statewide network. And then the federal vision is to have a national health information network so that if an elderly person decides they want to winter in Florida, their doctor down there can get access to all their medical records here from Rochester, from the Rochester RIO. The Rochester RIO is now self-sustaining. It has a business plan in which the partners are paying a membership fee, mainly the hospitals and the health insurance plans. And that's one of the most unique aspects of our local RIO, in that many other RIOs that have started around the country don't really have a sustainability plan. They've been set up with a grant from a foundation and don't really know exactly how they will be sustaining themselves into the future. So the goal is to reduce costs, improve the quality of care, and make the information more accessible, not just to the providers, but also to patients themselves.
Thank you. Through the chair, I guess I had been under the impression that it wasn't actually possible for any given patient to stop his or her information from being posted or shared, or whatever is the correct word, on the RIO. But is that inaccurate, that actually if I don't sign, or any of the patients at MCH don't sign the consent form, then doctors cannot access any of their information will not be on the RIO? Is that true?
It's a little bit more, through you, Madam Chair, it's a little bit more complicated than that. The information is loaded into various systems, but what the patient does is give consent for a particular healthcare provider to access the information. So if you were a patient at Monroe Community Hospital and I was the doctor there, and you didn't provide consent for me to look at the data that's in the RIO, then I wouldn't be able to do that. I would be able to look at the electronic health information that's in the electronic health record that is part of Monroe Community Hospital. Monroe Community Hospital has its own electronic health record, and what we're doing tonight is approving a contract to connect the Monroe Community Hospital electronic health record with the RIO. So by virtue of you being a patient at Monroe Community Hospital, you would certainly want your doctor to have access to your records there, but you might not want your doctor to have access to records from another hospital or from some other organization in the community, and you would need to give consent for that.
Okay. So the patient can't really stop the RIO or that information from being there. He or she just can stop his or her doctor from accessing what's there.
That's correct.
Okay, because the sentence here kind of reads, patient information is only shared if consent forms are signed. So I understand that what that meaning it's only shared with the doctor, or the doctor's only given access if consent form is signed, but the patient information is there already.
Conceptually, we made a big change in the way health information is shared when we went from paper to electronic. In the old days, you used to sign a piece of paper to release information to someone else, or to release the information from one doctor to another. Now, when you sign consent for your provider to look at information that exists in an electronic system.
Okay, all right. Why would RIO provide us with this gift of $20,000 for the software, through the chair?
The RIO, through you, Madam Chair, the RIO has a large grant from New York State to help healthcare organizations get hooked up to the RIO. And what this gift is really software that forms the interface between the RIO and the Monroe Community Hospital electronic health record.
Thank you. And I would imagine there must be a lot of security with this, with RIO. Can you speak at all to the security that's in place to protect all that patient information?
Through you, Madam Chair, the security is a very, very important part of the RIO. There are many forms of redundancy that are in place. It is taken very, very seriously. There's actually a staff person that is in charge of security at the Rochester Rio. There haven't been any breaches of or any problems that I'm aware of with the security of the Rochester Rio. Obviously, we are all worried that as technology changes, that there can be faults or there can be problems that might result in the possibility that some information could get out into the wrong hands. But that has not happened with the Rios around the country.
Thank you. And then lastly, I just wondered if you could provide a list of everyone who sits on the board at Rio.
Yes.
Thank you.
Any other discussion, Legislator Kaley?
Thank you. Through the chair, a little bit back to the consent. If a patient wishes to, can they rescind the consent at any time that they've given to a particular physician or institution?
Through you, Madam Chair, yes, they can.
Thank you.
Any other discussion?
And it just excuse me, through the chair, since we talked about Rio actually somewhat being, I'm not saying profitable, but moving along under its own speed, so to speak, through membership fees, will MCH be a part of that fee structure at a later date?
Through you, Madam Chair, I think it's probable that there will be a cost that will be borne by all of the users of the Rio at some point in the future. But at the current time, the sustainability plan, the revenue model involves just hospitals and the insurers.
Thank you. Then MCH considered to be a hospital would be?
No, Monroe Community Hospital is not considered a hospital. It's really a nursing home, and they are not part of the revenue plan.
Okay, and then through the chair, then if there was another large nursing facility such as MCH, I'm just throwing it out there, then they most likely wouldn't be paying a membership fee as well? Or is this, I guess what I'm trying to get at, is this sort of like a spot type of specific plan going after larger facilities to get them on board?
The original plan for sustainability for the Rio was basically to agree on charges just for the hospitals and the insurers. The thought was if it became expensive for some of the smaller operators that they would not be motivated, incented to participate. So the plan was to let the doctors sign on for free, let the nursing homes sign on for free. The ambulance corps are able to sign on for free. They have some expenses associated with this. As I mentioned, frequently there's a software interface that needs to be written. But in general, all of the users except the hospitals and the insurers are getting a free ride for approximately the next 3 to 5 years. And then the Rio will reevaluate what's the best way to charge for the use of this service.
Okay, thank you.
Any other discussion? Legislator Quadro.
Rio, the list of board members is available on the Rio website.
Thank you, Legislator. Thank you. Any other discussion? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. And then before I go to any other business, I just wanted to ask Dr. Doniger, because I know today there was an announcement at a news conference held by the Coalition to Prevent Lead Poisoning. So I believe you were quoted, Dr. Doniger, and about the number of children when lead poisoning edges up a little bit in Monroe County. And I wonder if you wanted to maybe just briefly give a little synopsis of what that news conference was about today?
Yes, thank you. Every year we release to the public, and usually in partnership with the Coalition to Prevent Lead Poisoning, we have a press conference to explain what the data means from the previous year. So we have data now from 2010, And in every year until now, the number of lead-poisoned children in Monroe County has been going down. There are two different statistics that we use. We looked at the number of children that have lead levels that are greater than 10 micrograms per deciliter, and we also look at the number of children that are more seriously poisoned, and those are the children that have levels that are greater than 20 micrograms per deciliter. So for that higher level, the children that are more poisoned, the number from 2009 was 27, and it went down to 13 in 2010. So at the much higher, more serious levels, we've seen about a 50% reduction, which is quite good. At the lower level, though, we went up a little bit. We went from 283 to 290 children with levels that are greater than 10. And I probably should mention that 10 years ago, those numbers were 2,000 or 3,000 cases of children with levels greater than 10. So we're down by quite a substantial factor of 10, I guess, over the course of the last 10 years. What we're all a little sad to see that the number went up. I think from a statistical point of view that probably is no change, and probably isn't possible to say that 290 is really different than 283, but we had hoped that it would continue to go down. What we've seen is this sharp decline in the number of these cases, and as we get closer and closer to the goal of getting close to zero, we're probably going to see some bouncing around for a while. We'll see some years where it'll go up and some years where it'll go down, and we'll need to just keep our eye on the multi-year trends. I don't think that things are going to reverse and we're going to start going up. There's still a lot of activity going on in the community to try to address the concerns around lead poisoning.
Thank you, Dr. Doniger. Any other discussion?
Could I just ask a question?
No, Legislator Kaley.
Thank you. Through the chair, do you have any knowledge of any cultural trend of the few that the numbers that have gone up? Do you see any cultural trend there?
I'm sorry, could you repeat the question?
I think a cultural trend in the population, the type of population that might be affected more. I'm not exactly sure how this information is tracked. In many neighborhoods, there are a number of families, we've talked about this before, refugee families that have come in from overseas. And I think what I'm getting at is if there's a trend that might be developing in some of those children coming here from camps overseas, coming into less than stellar housing, even though we want them all to be in wonderful housing. Many are placed in or have moved to less than stellar housing, and I'm wondering if there was a trend that might be visible in the next 3 to 4 years, because the population is increasing throughout the city over the last 5 years, and it will continue.
Through you, Madam Chair, yes, refugees are disproportionately affected by lead poisoning, and I don't have the numbers right in front of me, but I'm sure that a good portion of these several hundred children with lead levels over 10 are in refugees, but I don't have that information with me today.
Thank you. Just a note, I mean, it's helpful for us to know this. I myself work with a number of groups, and that gives us the opportunity to continually educate on an ongoing basis with the families as they're coming in. So thank you.
Thank you. Any other matters? Legislator Andrews.
Thank you, Madam Chair. Through you, if I could just request a status update on the possibility of outsourcing at MCH, the food and laundry service departments.
Madam Chair, there have been no decisions or recommendations made yet. That's still under review. So, but we'll be sure to report if and when there are.
Thank you very much.
Thank you. Okay, seeing none, no further business. The June 28, 2011 meeting of the Human Services is adjourned. The next meeting will be July 26th at 6 p.m. Thank you. Have a nice evening.